exactly. It's always
a community effort.
it sure is.
So Mike will be presenting on promoting safe cycling in older adults, insights from the COM-B model. So take it away.
Good, thanks Mark. Thanks everybody. Was interested in the Singapore side because we've just been doing a project on cycling, and of course Singapore's just opened up a whole bunch of new connected pathways for cycling throughout Singapore to encourage it as an activity to do. So anyway, that's our title. We're looking at safe cycling fundamentally. There's a whole lot of things that sit underneath that, and I'll talk to those today. As Mark mentioned, there's a big group of us involved in this. This project is driven primarily by Fatima and Daniel, but I'm going to be the spokesperson today for the research. So let's go. We are RMIT, and I'm part of something called the Consumer Wellbeing Research Group. We also have Shaping Connections groups, and we have a really big interest in older adults and their health and well-being. So we look across a whole bunch of different situations, from ICT and connectedness through to physical and mental health as well. And we know generally and globally that older adults are a big focus and need to be a big focus, a growing population with challenges with regard to their physical and mental health and their well-being. And all of those kind of issues start to play out. We see, in terms of social engagement and social inclusion that are in there, in terms of their cognitive health and the maintenance and continuance of that. Joyce was talking about earlier on today, maintenance in those programs to maintain health and well-being. But obviously in terms of trying to inform policy and investment from local and national governments as well is a very big part of what we do. So our research generally, and this one particularly, is kind of embedded in this in a global sense, but also in a national and local sense. So our project, as I said, is cycling. We could have chosen a million different areas, but cycling was the thing that we landed on. And like all research, it has a foundations both in terms of external motivations and internal motivations. So just in terms of the project, as I said, we've got a CWRG focus on older adults, but we've also got great partnerships with U3A, University of the Third Age. We've often worked with them and their various groups and constituents in terms of improving the older adults that participate in those U3A programs. So sitting behind this research is also connected into that partnership and the experience that they have with their adults and cycling. It's also connected to participation that we have in allied health and medical communities with the work that we do, geriatrics particularly, and this notion of looking at a strengths-based approach to improving the way that particularly older and elderly people engage in physical activity that improves not just their physical well-being, but also their mental and social well-being, relationship well-being, and those sorts of things. There's always a grant sitting behind these things somewhere, and so we have been chasing money, as we always do in these kinds of research projects, and the National Road Safety Strategy has a very big part looking at older adults and their safety with regard to things like micro-mobility, of which cycling is a part of that frame as well. So we have a mercenary perspective around this, and that we're chasing cash behind this as well. So this is a foundation for that. And then, of course, my involvement as part of my own personal journey, that I'm hitting past 60 and on the decline, those kinds of things. So it's looking at through my own kind of lens too. Anyway, that's where we are. So why cycling? Well, if you look at some of the statistics that sit around older adult cycling out there, it's still quite small with regard to the total population of older adults, but it has been increasing. So there is an increase since the 2021 version of the report in terms of the increase in older adults participating in that form of exercise or in that form of activity. I shouldn't just restrict it to exercise, right? Because we cycle for a multitude of reasons. And some of that's been connected to the rise of e-bikes and supported cycling as well, which, as we will talk about later, brings with it both access, but also kind of plays into this notion of vulnerabilities that we have as older adults too. And obviously, when we think about the benefits for cycling for older adults, it's beyond physical. And I think that's the point to make, that yes, physical is definitely important, but there's the mental health and well-being aspect of being engaged in this exercise. There's the fostering of social participation that's part of that. And I imagine most of you look around your communities and you see older adult cycling groups that exist out there. Certainly U3A has a series of them, and just recently they were actually up here in ACT doing a cycling tour of monuments and parliaments. So they brought their bikes up and did that. And then, of course, the kind of values-based side of it too. The sustainable society, the reduction of use of fossil fuels, plays into the mentality and the desire by some people to participate in that part of the community, if you like. So there's all of those kinds of benefits. I guess I'm repeating myself just slightly in this sense, but in one sense, because of that increase, and looking at the National Road Safety Strategy, starting talking about this increased vulnerability. The more that older adults get on the road, the higher the likelihood they're exposed to situations that can cause distress, psychological distress, but also physical accidents and hospitalizations. And we have seen some uptick in the area of hospitalizations, and some of the emerging stuff connects a little bit of that to the rise of things like e-bikes, where we're able to cycle faster, for example, and that goes to competence and capability to be able to manage the technology or the machine at high speeds. So we also know that as you look through the research, obviously government reports and local area reports talk a lot about the need to increase older adults and their participation, but there's somewhat limited academic research recently in that space, right? So it's fertile ground for investigation in an academic sense. And then, of course, sitting behind that, because we're looking at this road safety strategy as well, one of the critical issues they were interested in is how do we communicate? How do we provide messages? What kinds of messages should we be providing, and how should we express those and position those and place those to reach those communities effectively? So sitting behind this research is that. So just to summarise, our key focus, to really nail it down, because we're picking up on the COMBI model to help frame this. So those capabilities, motivations, opportunities and behaviours amongst older adults. We're doing a few things to take it up at one level, to kind of continue and to increase their participation, and within that to be safe in doing so. And as I said, to think about the communication strategies that underpin those that might facilitate some of that. And we have those fundamental research questions at the moment. I should point out that this is the first stage. It's a project in its infancy. And that's, we chased the grant, we got bounced from it, and so we're at the stage of writing as a team to provide the evidence to say that we can do a piece of research that has some use, and therefore you should give us some of that money. So it's a project in its infancy, and that will have an implication for what I say a bit later on. So it seems a bit weird that we're starting at a quantitative side rather than a qualitative investigation, but that's also because we were given some money to do something in a quantitative sense to kick this off. So we are using a quantitative online survey to collect some data at the moment. We're running it through a field house who's hosting the Qualtrics survey on our behalf, and it was funded by an RMIT small grant, a micro grant, if you like. Our focus is on adults 60 plus, and as I said, focusing on those who are current cyclists, and they're always broken down in terms of regular cyclists and occasional cyclists. We're talking about, or trying to talk to, lapsed but desiring re-engagement cyclists, And we see a lot of that where people have cycled previously, let it slip, and are now mentally at least looking to re-engage. The sample is national using the panels that we have. Our funding will allow us to get probably around 400 or so respondents. With that, the data collection is actually in field. So I'm reporting on a subset that I dragged out of the system over the weekend. So in that sense, I can present tentative and ongoing and kind of trends in terms of what we're seeing in the data. We're currently sitting at 181. I think looking at this morning, I think we're about 270. The challenge that we have with this kind of research, using this kind of methodology, is the incidence rate's quite low. If you're trying to find 60 plus cyclists in a particular panel set, which means that your incidence rate's quite low. So we've probably still got another 2 to 3 weeks of in-field data collection to get to the levels that we'd really like to. Anyway, the items drawn from Combi work, there's a little bit qualitative stuff on cycling and Combi from younger adults, from kids, those kinds of things. There's a couple of papers that talk to older adults in this space as well. We've married into that some of the barriers research. There's been a bit of barriers research done in Australia, New South Wales and other places, and married into that things like communication channel sources, trying to get some indication of that comms side of people's behaviour and engagement. Anyway. So please excuse the busyness, right? So part of this is kind of a mental puzzle for you to work your way across here. And I tried to highlight some of the key things that are coming out just in red so we can pick it up. In terms of who we're seeing responding at the moment, as you'd likely expect, a stronger identified male participation at the moment, but we're coming back to a field house to try and push a greater female participation in this. Urban locations rather than rural. But again, it's a reasonable response from the rural side, and of course there are challenges as an urban rider and a rural rider that we will explore in that data as well. In terms of living arrangements, in own home, but interesting in rental properties as well, and from a social marketing perspective, older renters are kind of an interesting population regardless. I won't push this too far. Obviously mostly retired, couples with no children living at home are the dominant kind of position there, and at the moment our data is coming from Western Australia and New South Wales, but overall a reasonable demographic spread of participation and response. In terms of their cycling behaviour, so we're picking up at the moment in the sample more occasional and recent past cyclists in here, which again is interesting because that's a community that we'd like to focus on from a comm sense to lift their participation if possible. The frequency of cycling is kind of still quite low, a day per week. So there are implications there in terms of some of the dependent variables we have in terms of increasing participation. The type of cycle, standard road cycles, but we can start to see in here some of the electric bike kind of adoption taking place here in terms of standard road cycles and a little bit of the electric mountain bikes. Looking at the pattern of data, quite a number of people have more than one cycle as well, so they've got two. Some of them have up to 3 or 4 different bikes in there as well, so there's a patterning that's interesting to explore. And the reasons for cycling, again, they were able to select multiple reasons here, but you can see exercise and fitness is still a dominant, recreation and leisure is very much in there, and then the rest is spread across things like running errands and visiting friends and those things. So there's still a very strong exercise and fitness kind of domination of the rationale and the reason for participation. All right. We use Combi, as I said. Combi has all of these different kind of dimensions to it and subsets to it. I tortured the data a little bit at a level. I divided those into some factors. So, for example, under psychological capabilities, there's three kind of factors that sit under there. Under physical capabilities, there's a couple as well, and so forth. I'm not going to work my way through these, but these will play out over the data that I do have. All that I did at the moment was run some t-tests between different groups to see what was coming out in terms of some differences. And then I ran a simple relationship analysis to see what was mostly associated with a couple of the dependent variables that we're most interested in exploring. So I'll give you some patterns at least. Again, lots of words, but I've just highlighted a few in the red. Oh, 5 minutes are running, too easy. We looked at differences between occasional and regular cyclists, and you can see some of the things that are playing out there. Physical capability, social opportunity. So occasional cyclists, if I pick just one of those, find they have less support from family, less support from friends and community about being a cyclist or participating in cycling. So there are implications with regard to that. From a motivation perspective, they also exhibit less of the kind of joyful emotion around participation in that. So they have less joy, less stress relief for participation, less utilitarian value from doing so, and a greater belief that cyclists are for young fit people, or cycling is for young fit people. So there's kind of that motivational element that sits under there. From a capabilities perspective, and we were looking at identified female and male participants, and here what seemed to come out of that. So a few things, again, consistent with the literature, the perceptions and around basic and advanced cycling skills seems to be a difference. These are just differences. There's nothing about their participation at this stage. One of the things that did come out, although the mean's not that high, but I drew it from some of the work that's being done in Melbourne, that the experience of harassment and sexual harassment, verbal and sexual harassment, was one of the things that was different between male and female participants. Now, I can't say to what degree that shapes actual behaviour, but there is a difference in that experience anyway. All right. One of the things we want to do is champion safe cycling. So what's associated with both you as a safe cyclist, but your willingness to champion safe cycling to your peers? A couple of things dropped out of that as kind of most significant at this stage. So higher competence, higher safety knowledge, and higher ability to navigate hazards around the streets was mostly associated with being safer, but also championing that behaviour with peers. And likewise, the notion of social opportunity comes out in that again. Community encouragement and family flexibility, the willingness of my family to adjust their behaviours to allow me to cycle, was something else. So it's not just tacit, kind of support, but it's actual behavioural kind of change from the family side to enable that. What else is coming out? Joy, utility, stress relief, pride in riding. So again, this kind of emotional engagement with the cycling activity and the expression of joy, the stress relief side of that was popping out of the initial analysis in terms of being associated with safe cycling. Probably about 1 minute left. 2 minutes or that, plenty of time. One more that we had, we were interested in cycling reducers. So we asked the question, to what extent are you likely to reduce your cycling over the next 12 months? And to understand why that might be and how we could promote or turn around that desire to reduce. So again, it comes back to social opportunity as a strong factor. So this limited family flexibility or limited encouragement was associated with I'm likely to reduce my participation. The lack of a sense of accomplishment was associated with that, and increased cycling-related anxiety. So, it's early stage, as I say, so I can't be concrete about these things, but there are trends in that data which look interesting enough for us to explore. And I just kind of thought about, well, if that was the data we had, what were some of the things that we might consider doing from a comms perspective? And again, a couple of things in red there. This positive messaging element, this strengths-based messaging element, it's not about decline and overcoming decline, it's about joy and freedom and all of those positive expressions of being engaged in this activity. The age-inclusive normalisation element in there, that it's every day. It's not novel, or it's not unique, or it's not ground in a specific event. For some people it is, but that normalisation of it as a behaviour. And this notion of reward. If we looked at the men versus women data, that some of the women were more likely to reward themselves post a cycling activity. So there's a reward aspect to that as well. We're social marketers. I hope that's not a glass of wine and things. For me, it probably is. But that's where we are so far. What are we doing? Completing that data collection is a very, obviously, an important part. Analysing, publishing, having that proof to chase that money. Working with U3A. So that's our next, to both extend the data collection but also to work with their cycling programs. One of the challenges they have a little bit is that in forming the cycling communities and the cycling groups, they start to almost be a bit exclusive. And people feel a bit fearful about joining this group who have bonded and are going on these rides all the time. So it's how do you open that door to be more inclusive for some of those people. Anyway. And as I say, money at the end of this to extend this research. Anyway, that's a snapshot of where we are. Happy to take any questions. Thank you.